The following is a conversation between Rosanne Haggerty, President and CEO of Community Solutions, and Denver Frederick, host of The Business of Giving on AM 970 The Answer in New York City.
There are some social problems that, as unfortunate as they may be, just need to be accepted as a fact of life that will always exist to one degree or another. And one of those that most people have resigned themselves to is homelessness. No matter what we do, it will never be eliminated entirely. But my next guest is not most people. She is Rosanne Haggerty, the President and CEO of Community Solutions. Good evening, Rosanne, and welcome to the Business of Giving.
Thank you for having me here.
You have said that the world is full of complex social problems for which no reliable, cost-effective solution has been found. Homelessness, however, is not one of them. Explain to us what you mean.
All over the country, we're seeing communities make profound strides in reducing homelessness and ending homelessness for good among people who are chronically homeless, meaning they've been homeless for long periods of time, and homeless veterans. And so we really misunderstood this issue, and much to be excited about here in terms of what can be accomplished when cities organize their resources properly. That's the big aha.
Tell us about Community Solutions. This is now the second organization that you have found, albeit related to the first one, which was Common Ground. What is the philosophy of Community Solutions and the goals and objectives of your organization?
We help communities solve the complex problems that affect their most vulnerable residents, and we do that by bringing tools from other sectors that have been effective in solving complex problems, from design thinking to quality improvement to data analytics. And so that's our mission. We have redefined homelessness as a symptom of the larger problem of the breakdown of community systems.
You started this work back in the early 1980s, and you were exceptionally idealistic back then, and you were really hopeful that homelessness was a solvable problem. But what you witnessed was quite disheartening and gave you a little less of an optimistic outlook. What did you see back then?
Well, when I first moved to New York, at a time that homelessness itself was a newly defined issue in the early 80s, I worked by day at a shelter for homeless and runaway young people, and overnight once a week volunteering at a shelter, church basement shelter for homeless women. And I think in my naivete, I was full of the belief that, well, if we had enough volunteers and shelters, we can nail this.
We can lick this thing.
It's a new issue. It's kind of happened on our watch. And within a couple of months in both places, I just was appreciating this huge disconnect. I think I had imagined that there was some larger plan, that if we got enough volunteers to staff the shelters, this was all going to work out. But at the shelter for runaway and homeless youth, the young people could stay for a maximum of 30 days. And I quickly saw the young people I was responsible for, their problems were not 30-day problems. They were permanent problems around housing, jobs, families that had fallen apart. The real complexity was not homelessness, but poverty that had driven them into homelessness. And yet we would discharge them after 30 days. No surprise, most of them would be back 30 days later.
Right.
After a few months, I was like, what exactly are we accomplishing here? This is certainly not something that's solution-oriented. And meanwhile, in working as a volunteer overnight with these women who would be bused to the church basement shelter, they have been lining up for hours and traveling all over the city before being dropped off. They would just sort of stumble in exhausted, and a few of them I would be able to speak to, sit down over tea or something, and it was clear that none of them had any kind of idea how they were going to get out of homelessness, and no one was talking to them about how that could happen. What they knew and had been instructed to do was when and where to catch the bus to get to that overnight shelter. And so, there I was as a 21, 22-year-old thinking, wait a minute, nobody's in charge here.
Yeah.
There are a lot of well-intentioned emergency efforts, a lot of people like me who are trying to pitch in, but this is not going anywhere.
Mm-hmm. Well, I think you also witnessed that the resources, in many cases, were there. And as you just said, people were really deeply heartfelt and had the best of intentions. But the system itself was broken. How was the system broken?
Mm-hmm. Well, I think what we've come to see, and I'll start from the vantage point of 2016, and sometimes it takes a while to understand and really see what's going on, is that the dots weren't connecting between people who could not solve their housing needs in the marketplace, who needed something other than just affordable housing in many cases in order to resolve the problem that was making them vulnerable to homelessness. So, for instance, in the early 80s, we saw, just this very significant increase of individuals with mental health difficulties now on the street. It was the beginning of the AIDS epidemic, kind of the early fallout of the country's lack of investment in expanding the supply of affordable housing. We were beginning to see the impact of really stagnant wage growth.
Mm-hmm.
And so all of these forces were converging, and yet we were opening shelters and thinking that was the answer. And so, just to fast forward to 2016, what we realized is needed not just in homelessness, but in many of these really tough issues that are facing our most vulnerable citizens, is we need to connect the dots more easily. It's, homelessness is a health, housing, mental health, substance abuse, wage issue. And rather than being overwhelmed by that, what we've learned is you got to get all those people at the table and kind of make it simpler for vulnerable people to get what they need. It's the job of not-for-profits and government to simplify the process of getting people the tools for a basic standard of living.
Yeah, and as you said, that social welfare system was the thing that was actually in the way of getting somebody who was living on the street into some kind of stable housing, because the rules and the regulations they set up really made it virtually impossible unless you were an Einstein in navigating the bureaucracy.
Yeah, we saw the problem after a while, and it was us. That there was literally no way, we discovered when we started focusing on street homelessness, that someone living on the street could actually get themselves into any kind of publicly assisted housing. You weren't eligible for it. People ask, why do we have homelessness? Well, we need to look at what are the rules we've created, what are the barriers that we've created in the way of getting these problems solved. The tragedy is, good people have, unwittingly conspired to create institutions and systems that, because they don't connect and because they're not really grounded in how do we help the person get what they need as quickly as possible, that we've ended up in a much more tangled state that actually, blocks progress.
And although it's pretty fashionable to disparage the healthcare system, you've noted that working on the issue of homelessness could very well learn something from that sector. What are some of the strategies and procedures that would be helpful if adopted?
Our healthcare system, for all its need for improvement, understands that you need to know people by name. You need an individual diagnosis. That you need to triage the most urgent cases. It's never the case that everyone has the same thing and it needs the same level of urgent attention. You understand within the system that generalists and specialists need to communicate with each other. At least those habits are ones that, if we applied them to housing needs, I think we would be in a different place. And in fact, that's what we're seeing in our Zero campaign, that in getting the right configuration of person-specific information, understanding people's different level of need, and facilitating around data, person-specific data, the kinds of problem-solving conversations that need to happen with a team that we're able to help communities make progress.
That's a very interesting observation, because I think almost everybody looks at homelessness as a generic problem. We got to fix homelessness. And we also think about that static waiting list where you put people on, and that's not the way the healthcare system works, and that's not the way this system should be working as well.
Precisely. I mean, we'd all think it was absurd if anyone who showed up at the emergency room was either given aspirin or scheduled for brain surgery. But that's kind of the way we've handled things in homelessness.
You talk about trying to connect the dots and getting all the players aligned together. We have the VA, we have the nonprofits, we have governments, we have all the housing authorities and all these folks. And I think that a lot of people recognize that. That's kind of been out there, that we have to have everybody working in unison. But it's a whole different idea to actually get people to do that. They come from different bureaucracies. They have different theories of change. You have the egos that are involved. Share with us the secret sauce of getting this done and changing the habits of how organizations actually go about doing their work.
We have found that in just about every community, there are leaders there that have never lost the original vision and drive to solve this problem. And it's always critical to connect with the leader or leaders who can bring a community team together, which minimally has to consist of the mayor's office or whoever controls the health and mental health resources in a community, the housing authority, the not-for-profits, and the VA. If you get that group at the table, seeing the problem the same way, which is really about person-specific data. who exactly is homeless in our community and who is at elevated risks for prolonged homelessness or for dying on the street, given the health risks that attend long-term homelessness. And once communities have a starting point, which is real-time person-specific data, begin to understand and measure how long it takes that community pulling all of its resources together to get a single individual or family into a stable home, you're beginning to move past ideology and all of the kind of mythologies that have surrounded homelessness to actually we have a pretty clear-cut job to do. We have this number of individuals who are not going to find their way out of homelessness on their own. How do we pool our resources across these different systems, and how do we know we're doing the job well and getting better at it? And so much of this is coaching communities around how they overcome some of the communication and data sharing barriers, how they actually align their resources so if someone has the mental health contract, that they're partnered with someone who is actually overseeing the rent subsidies, and how the VA gets involved in working with community systems that they often had not worked with before until the homelessness issue became a priority for the VA. So it's really this discipline around putting the pieces together. And I'd say that maybe the image to think about is if community is dealing with a public health threat, polio, Ebola, you would do basically the same thing. Or like there's a surging hurricane. Who are the most vulnerable? Where are they? What do we need to do? How long is it taking us to do it? Has the situation been resolved? And it's bringing that type of rigor and collaboration that we see in disasters into something that's frankly been a slow-moving disaster.
Yeah. Before I get to a couple of your signature programs, Rosanne, I just want to ask you a few questions about sort of the general beliefs that people have about homelessness. One of them would be that some people are simply service resistant. This is a deliberate lifestyle decision of theirs. They want to live on the street or they can't be helped. Is this true or false?
Well, I had to learn that was not only false, but tragically so. For years, when I was focused on building housing for the homeless, I would walk past individuals in Times Square or Midtown Manhattan and see these poor souls and not infrequently call outreach teams saying, I just saw someone and we know who she is or we know who he is. They're service resistant. And so I guess my guilt was sort of discharged in that I had made the call. But then one day, one of these service resistant people, actually a hospital social worker, called me and said that she wanted to be housed at one of our buildings. And come to find out, in speaking with this woman who'd been homeless over 11 years, she said, I always wanted help, but with housing. The only thing I was ever offered was a ride to a shelter, blankets, and food. And it was like,
light bulb went off.
A total light bulb going off moment, which is, what if we have just been out there offering what we happen to have, what we think people need, rather than asking them, what help do you need to get out of homelessness? And so we basically started, questioning every assumption we had about what are the familiar mythologies that surround homelessness. And guess what? Almost every one of them was wrong.
Incredible. Another mythology is that homelessness is a big city problem.
Yeah, hardly the case. I mean, you have certainly, when you look at the map of homelessness in the United States, homelessness is everywhere. It's, of course, concentrated in large cities, but no city and no rural area, no county escapes it.
Another question I think people have, too, is we can't really afford to take these people and get them off the street and put them into some kind of housing. So the question becomes, what's the cost differential between doing that and providing the services that people need when they're living on the street?
Well, the crazy and the hopeful thing is that in cost studies in communities all over the country, it's been verified time and again that we're spending more money to keep people homeless than would be required to actually help support them in getting into a stable home and getting connected to mental health services or the employment assistance they need.
Wow, that's remarkable.
The numbers are staggering. I mean, it's not even marginal. It's, I think now New York City spends over $40,000 per year to keep a family in shelter. The most robust rent subsidy would result in a fraction of that cost.
Well, about 6 years ago, you launched the 100,000 Homes campaign in partnership with 186 communities across the country. Tell us how it worked, Rosanne, and what you were able to achieve.
Well, important to know that when we launched it, I think we had maybe 30 communities, mainly, our friends who are like, okay, we're with you. This sounds crazy, but, it's the right thing to do. And it was basically out of this insight that what if we are looking at the issue wrong, that it's not about all the things we say it is, like we don't have enough affordable housing, we don't have enough this, we don't have enough that, people aren't cooperating. What if the people working on the problem, the not-for-profits and governments, what if it's about our behavior and how easy or hard we make it for people to get off the street? And so what we did was we issued this invitation to communities around the country to join in the effort of figuring out how to work better and smarter toward a collective target of 100,000 chronic and vulnerable people housed in 4 years. And so we had tested this. We began with a project that we had initiated in Times Square, got to some proof points, but we thought, like, here are the key ingredients. And then we worked first with 9 and then up to 30 communities who joined in. And so we knew that we had some basic ideas that worked everywhere. And what was powerful, though, is that each community who joined improved our original idea. And so by the end, there were 186 communities involved, and it was essentially a giant behavior change and process improvement initiative. And as I mentioned earlier, getting the right players in a community together, using data to actually tell, like, what the heck's going on? Do we have our arms around this problem? Do we know actually who's homeless, or are we just kind of guessing?
Yeah.
And do we know how our systems are performing? In many ways, when we went to different communities, it was an occasion for groups that had never worked together before but needed each other's resources and intelligence if they were ever going to, at the community level, solve the problem. So we were thrilled to see that our original assumption that a behavior change, alignment of resources, the kind of discipline around sharing and working at the community level, not as different institutions doing our bit, but really forming a team. Those 186 communities together house more than 105,000 people. Hats off to the communities, because the hard work happened there, and our team provided the coaching and the data infrastructure and provided a new community of problem solvers to belong to.
That's great. And this is an extension of this housing first concept. Would that be correct?
Very much so. And that was a key idea, that housing without condition is the first step in enabling a chronically homeless person or a person with medical vulnerabilities to actually get on the other side. And from a stable place to live, the mental health and addiction services and everything else that person might need. First of all, you can find them to offer them, and then they can be provided consistently. It provides a very proven win for the individual and a huge win for communities.
And you just said a moment ago that it was less expensive for taxpayers to support someone in housing than it would be associated with caring for them on the street. So what would the cost savings be of these 105,000 people that you were able to move into housing?
Well, we hired an outside evaluator to look at the cost impact of the first 100,000. And what was concluded was that it represented a $1.3 billion, that's with a B, annual. So that's a recurring savings, mainly in cost avoidance in the healthcare system, but also in cities that have large shelter systems, and also in the criminal justice system and in the VA.
Fantastic. Well, soon after the 100,000 Homes campaign was completed, you didn't sit around too long. You launched something called the Zero 2016 campaign, and now you're working with 70 communities. Tell us about the goals and objectives of that initiative.
Well, what we realized with the 100,000 Homes campaign was that this drive to change the way communities understood and worked on the problem, was a powerful and now proven insight. But the ultimate, objective here is not simply to count up and, get more people housed, but it's actually how do we help communities get to a point where they actually don't have people in long-term homelessness and have a system that can prevent and end individual and families' homelessness. And so the Zero, I have to say, is even more audacious. It's like who's in as far as building a system that can sustainably end chronic and veteran homelessness and create the local infrastructure that can work all the way down to prevent and end people's homelessness of every stripe. But the target for these cities is getting to a sustainable end to chronic and veteran homelessness. And I think 6 of the cities are already there. We're going to have to continue Zero past 2016. But, it's these 70 communities are all in, and it's a powerful thing. It includes 4 states, actually, and, huge areas like Los Angeles County. But it's I think, an enormous tribute to, these local leaders who are basically putting aside, their old programs, their old assumptions, and saying, what do we have to do to be communities that end this problem?
And aside from leading and orchestrating some of these national campaigns, you also get pretty deeply involved in some communities. One of them is Brownsville, Brooklyn, where employment and safety are among the major concerns. Tell us about your Brownsville partnership.
Well, a few years ago, as we were getting ready to launch Community Solutions and asking ourselves these system-level questions about, like, what if we worked differently and changed outcomes for vulnerable people through, frankly, making it easier for people to get what they needed. We asked the question about what we know about what causes homelessness and what does the pathway into homelessness look like. And the data we have been able to gather both in New York and Hartford, where we work deeply, but in communities around the country, point to the neighborhoods of concentrated poverty in our country, where people have struggled the longest, where lives have gone off track early, and where there's huge government investment, but not in ways that often, sadly, create opportunity and improve the standard of living for people, but like homelessness, are very reactive. And so Brownsville represents one of two efforts to basically get the right people around the same table, residents, government, not-for-profits, businesses, to start actually looking at how we change the conditions that trap people in poverty. When we began our work organizing and listening to the community, we heard three things over and over again. Like, for this neighborhood to change and for people to have different lives, we need to do something around crime, but mainly the impact of the criminal justice system and so many people involved in in incarceration and its effects. We need something for children to get them on different pathways, and we need jobs. And so we have recruited amazing partner organizations with expertise in those areas, and it's as with our homelessness work, we think it's the same problem. How do we connect the dots? How do we reduce friction? How do we make it easier for the intentions of our society to create real opportunity to actually be manifest in the outcomes of these programs for low-income people?
And probably, Rosanne, the best partner you've been able to engage have been the residents of the community themselves, and you have something called the Brownsville Hope Summit. Tell us about that.
Well, the fourth annual Hope Summit is coming up on September 10th, and we move it around each year to basically have a day
October last year, right?
It was, and this year it's the theme is Live on Livonia, so we pick some part of the community that's struggling as some geographic location and invite all the institutional partners, government, residents to come out and how do we pool our ideas and resources to get something done here. And so year after year, chipping away. So
there you go. I like the way you reframe problems, and that's always a great way to get some new insights. So instead of looking at homelessness as one of these chronic and intractable problems that's experienced by maybe 1.5 million Americans every year, you began to look at it through the lens that, hey, over 99% of us have homes. How did this different prism around the issue change yours and others' thinking?
Well, we are big believers at Community Solutions in looking at what works. I think maybe we're just congenital optimists or people who, very hopeful. But that notion, I think probably it dates from a couple of very seminal experiences early on in our work. I remember when we were operating our big supportive housing buildings, my colleagues and I would be tearing our hair out over the couple of tenants who just, their struggles. You'd convince yourself, because you're always talking about the same problems, that the whole, this is impossible. But what we learned to do is hey, wait, we're talking about 3 people. We have, thousands of people who are doing well. Let's keep some perspective here. And then when we started focusing on street homelessness, we realized that while there were dozens and dozens of people who we would identify on the street when we started doing our by name work, that there was only a group of 18 who were homeless every day in Times Square. And when we focused on getting those individuals housed, that represented the real core of the problem. And so it's caused us to think that life really is organized not around the 80-20 rule, but it's more like the 95-5 rule.
Yeah.
And so if you can figure out where the problem is most acute and learn your way in with the participation of the people suffering the problem, learn your way into what are some practical things that can move the needle. We have never not seen progress.
You've taken all what you've talked about and you've simplified it down to 3 critical things that are necessary to end homelessness. And I'm going to ask you to speak to each of them. The first, which you've touched upon already, but I think it's worth reiterating, is this: know people by name.
In some ways, it's the most revolutionary finding of all, that communities that are really getting to sustainable zero on chronic and veteran homelessness, it's completely correlated with a by-name list. Do they know each individual who is struggling in homelessness by name with enough information to help triage them into housing and get them what they need? Some people will need a lifetime of support. Others need help with the first month's rent. And if you begin to actually know people by name, it doesn't only open up the door to solutions. It frankly engages a community in problem solving in powerful ways. Think of the difference between we have an estimated X number of homeless individuals and knowing that that is this specific individual, John, who has a specific history. We have seen in communities around the country, people coming out of the woodwork to help because they know the specifics of that person's life and that person's need. So it's sort of definitive baseline. This is how you solve problems in a complex world.
And those names change every day, right?
They change every day. And so that's why the real-time nature of the information is so critical to communities.
The second, which is a little bit different than the sector generally operates, is to learn by doing.
Any problem, not just homelessness, but anything that is daunting really requires testing and learning. And somehow we got to a point where, whether it's government contracts or a proposal to a foundation, you have to sort of suggest in these big, complex, unknown things that you already have the answer.
That's exactly right.
And that's just not the way the world works. And so a very wise friend of mine highlights the difference between risk and uncertainty. If you've done something before, you can kind of calculate the risk of, are the conditions right? Do we have enough money? Do we have the right team? But if something hasn't been figured out, you're in a different universe, and you need to create the conditions that support learning, the development of probabilities, and it's going to require a long time to stick with the learning. And this really, I think, from a philanthropic and government standpoint, is a challenge I'd like to put out there. Be at the table in the learning. Don't expect that these problems are going to yield to a silver bullet.
Yeah. I can't tell you the number of people I know who have these contracts with governments or foundations, and in the midst of them learn that it's not working, but they have to do it because they have an agreement, so they have to fulfill it despite the fact that they know it's not the way to go anymore. Yeah.
It's like we have all this kind of time in the world to keep going down the wrong path.
Right.
I think, with our team, we have, an amazing group that's like, hey, actually, we've got, a higher duty to, try to get on with things and do more of the right thing.
Mm-hmm. You're absolutely right. And the final one is make success visible to inspire others.
Yeah. We really, I think, as humans, don't believe that something beyond our ideas is possible unless we've seen it, touched it, visited it. And so what we've learned is how important it is to give people who are skeptics or who just are genuinely unaware of what to do, share stories, share important, graphic information, have them visit your building, have them to see that, it's possible to create, good affordable housing that works for formerly homeless people. And very powerfully, we've learned the impact of video, that this notion of sharing stories, information is critical, and I keep mentioning data, but without the stories, you really don't grip people with a sense of the possible. And so it's become, I think, one of our key learnings that communication is an add-on. Communication is core to the mission.
Yeah, I've been to your website and I've seen some of the before and after pictures of individuals that you've helped, and they have been amazing. Speaking of your website, if people want to learn more about Community Solutions, if they want to get engaged in some way or perhaps become a financial supporter, what would you have them do?
Well, please do come to our website, which is cmtysolutions.org.
Well, Rosanne Haggerty, the President and CEO of Community Solutions, I want to thank you for being on the program this evening. We human beings have a wonderful way of making things quite complicated, so it comes as quite a surprise that when it is all said and done, the best way to end homelessness is to simply provide homes for people who do not have them. It was a real pleasure, Rosanne, to have you on the show.
Thank you so much.
The Business of Giving can be heard every Sunday evening between 6 and 7 p.m. Eastern on AM 970 The Answer in New York and on iHeartRadio. You can follow us at Biz of Give on Twitter and at Facebook.com/businessofgiving.